if your period comes whenever it wants, and your doctor prescribed Duphaston, you need to watch this. Today we're revealing Keycap 1: How Duphaston actually regulates your cycle, the science behind it. Keycap 2: The right way to take it. Most women make these mistakes. Keycap 3: When it helps with fertility, and when it doesn't. This isn't just medical advice. It's cycle control knowledge every woman should have. The active ingredient in Duphaston tablets is dydrogesterone, a synthetic version of progesterone. Duphaston tablets are used to treat female reproductive cycle disorders such as infertility, irregular menses, and uterine bleeding. They work by mimicking the activities of the natural hormone progesterone, helping to alleviate the symptoms of hormonal imbalances. Dydrogesterone uses. Dydrogesterone is a synthetic progestogen that works similarly to the natural hormone progesterone. It is used to treat menstrual disorders caused by hormonal imbalances, prevent miscarriages and abortions, relieve pain and menstrual cramps, treat endometriosis, a condition with symptoms like abdominal pain and menstrual irregularities, treat secondary amenorrhea, absence of menstruation due to reasons other than pregnancy or menopause, address various disorders like dysfunctional uterine bleeding, premenstrual syndrome, threatened abortion, habitual abortion, infertility due to luteal insufficiency, and hormone replacement therapy. The following dosage regimens are recommended for treatment with Duphaston. Quantities can be adjusted according to the seriousness of the disorder to be treated and the individual patient's responses to the treatment. Regulation of the cycle. It is possible to achieve a cycle lasting 28 days by giving 1 tablet of Duphaston a day from the 11th to the 25th day of the cycle. Endometriosis. 1 to 3 tablets of Duphaston a day from the 5th to the 25th day of the cycle or for the entire cycle. Dosages of 10 mg several times a day should be spread over the day. It is recommended that treatment should start at the highest dose. Dysmenorrhea. 1 to 2 tablets of Duphaston a day from the 5th to the 25th day of the cycle. Dosages of 10 mg several times a day should be spread over the day. It is recommended that treatment should start at the highest dose. Infertility as a result of corpus luteum insufficiency. 1 tablet of Duphaston a day from the 14th to the 25th day of the cycle. Treatment should be continued for at least 6 consecutive cycles. It is advisable to continue this treatment for the first months of any pregnancy at dosages as indicated for habitual abortion. Threatened abortion. Starting dose. 4 tablets of Duphaston at once followed by 1 tablet of Duphaston mg every 8 hours. Dosages of 10 mg several times a day should be spread over the day. It is recommended that treatment should start at the highest dose. If the symptoms persist or recur during the treatment, the dose should be increased by 1 tablet of Duphaston every 8 hours. The effective dose should be maintained for 1 week after symptoms have ceased. It can then be gradually reduced. If the symptoms recur, the treatment should be resumed immediately at the effective dose. Habitual abortion. 1 tablet of Duphaston a day up to the 20th week of pregnancy. The dose can then be gradually reduced. Treatment should preferably be started before conception. If the symptoms of threatened abortion occur during treatment, treatment should be continued, as described for that indication. Dysfunctional uterine bleeding. Bleeding is stopped by 2 tablets of Duphaston a day for 5 to 7 days. The blood loss is reduced considerably within a few days. A few days after the end of this treatment, a heavy withdrawal bleed occurs and the patient should be warned about this. Subsequent heavy bleeding can be prevented by prescribing a prophylactic dose of 1 tablet of Duphaston a day from the 11th to the 25th day of the cycle, if necessary combined with an estrogen for 2 to 3 cycles. After this the treatment can be discontinued in order to check that the patient has a normal cycle again. Secondary amenorrhea. 1 or 2 tablets of Duphaston per day from the 11th to the 25th day of the cycle to give optimum secretion transformation of the endometrium. that is adequately prepared with an endogenous or exogenous estrogen. Premenstrual syndrome. 10 mg twice daily from day 11 to day 26 of the cycle. There is no relevant use of dydrogesterone before the menarche. The safety and efficacy of dydrogesterone in adolescents aged from 12 to 18 years has not been established. For the contraindications, Duphaston is not used when patients have vaginal bleeding where the cause has not been established, presence of serious liver disorders, or serious liver disorders in the medical history until the liver function values have returned to normal. Contraindications for use of estrogens in combination with progestogens such as dydrogesterone in combined therapy. Known hypersensitivity to dydrogesterone or any of the excipients. Known or suspected sex hormone-dependent malignancies. Side effects of dydrogesterone. Common side effects: nausea, abdominal pain, vomiting, diarrhea, itching, hives, depression, mood swings, headache, dizziness, drowsiness. Serious side effects: breast pain, vaginal bleeding, stomach pain, menstrual disorders. Most common side effects do not require medical attention and will subside as your body adjusts to the medication. However, if you experience serious or rare side effects, seek medical attention immediately. Pregnancy. It is estimated that over 9 million women have already been exposed to dydrogesterone during pregnancy. To date, there were no indications that the use of dydrogesterone during pregnancy has a harmful effect. In the literature, a study is described in which it was found that the use of some progestogens can be accompanied by an increase in the risk of hypospadia occurring. However, because this has not been clearly confirmed to date in other studies, no final conclusion can be drawn about the effect of progestogens on the occurrence of hypospadia. Clinical trials in which a limited number of women were treated with dydrogesterone in the first stage of pregnancy did not show that the risk is increased. To date, no other epidemiological data are available. Lactation. It is not known whether dydrogesterone is excreted in breast milk. No research has been done into the excretion of dydrogesterone in breast milk. Experiences with other progestogens indicate that progestogens and their metabolites are found in small quantities in breast milk. Is not known whether there is a risk for the child. Dydrogesterone should therefore not be used while breastfeeding. Fertility. There are no data on the effect of dydrogesterone on fertility. Pharmacodynamic properties. Pharmacotherapeutic category. Urogenital system and sex hormones, ATC code. G03DB01. Dydrogesterone is a synthetic progesterone with an oral biological availability that causes a secretory phase of the endometrium in a uterus prepared by estrogen. Gives protection against the increased risk of endometrial hyperplasia and/or endometrial carcinoma that is induced by estrogens. Dydrogesterone has no estrogenic, androgenic, anabolic and corticoid properties. Dydrogesterone does not suppress ovulation. As a result, conception remains possible if dydrogesterone is used by women of childbearing age. In postmenopausal women with a uterus, estrogen replacement leads to an increase in the risk of endometrial hyperplasia and endometrial carcinoma. The addition of a progestogen prevents this additional risk. Whether you're taking Duphaston for irregular periods, PCOS, or fertility, remember you're not alone. Join our women's health community. Keycap 1 like if you learned something new. Keycap 2 subscribe for more hormone health videos. Keycap 3 comment your questions about cycle regulation. At HeInfo, we believe every woman deserves to understand her body. You've got this.